Canada.
Oh,
how are you feeling today?
Not so good, eh? My healthcare system is in a total state of disrepair.
Oh no. Okay, well I'm gonna get you to sit up on here.
Alright.
Breathe in. And once more, please. Oh no, that doesn't sound good at all. I'm gonna have to write you a prescription.
What for, eh?
Well, first, you're gonna need to put foreign trained physicians on the fast track of training. Then you're gonna need to establish two-tier care. And last but not least, you're going to need to provide incentives for new and practicing doctors.
This is taking so long.
Hurry up! I'm gonna get nine. I'm up at Mexican.
Can't they put us through any faster? They need another cashier.
I can help you over here if you're willing to pay an extra fee of $2.
How was your day, honey?
Oh, it was so good. All the children I worked with are just amazing. How was that meeting today?
It was long, stressful, lots of numbers being thrown around and getting nowhere.
Oh, that sucks. But I heard that...
How was the meal?
Oh, it was wonderful. Thank you.
Delicious, yes, thank you.
But was it magically delicious?
Oh, it was.
It was really
Thank you
good.
very much. Oh, thank you for the wine.
Oh, thank you. I love your accent. Where are you from?
I am from Ireland.
Oh,
Your
very
fire
nice.
right there, you can just tell. Yes,
Good evening.
Thanks.
so thank you very much.
Oh my god.
Oh my god, are you okay? Please help! Anybody! Is anyone a doctor? Help! Help! Is there anyone who can help? A doctor, a nurse, anyone, please!
I'm a doctor, or I was back in Ireland, but I can't find work in Canada, so I'm but a lowly busboy. I'm afraid a Canadian-born rabbit would have a better chance of helping him than I would.
Save Canada's healthcare.
Oh, hey, doctor, how you doing, eh?
Oh, hey Canada, how are you feeling now?
Really good since all of your advice. It really helped me.
Good.
Hi, can I see the doctor?
Yes. He's right to you. Are you
It's McGill. Okay. So, what seems to be the problem? My knee, the signs won't go down. Oh, it looks like we're going to need an MRI. Sounds great. I'm free all next week. I'm going to next week. Seriously. What's your schedule look like in January 2011? 2011? I have to wait until 2011 to get an MRI? But what if I pay a little extra? If I pay a little extra, could I get my service a little quicker? Payment in exchange for a service? Maybe I should write a referral to a psychiatrist. Look, paying me for doing my job is illegal. Neither of us have a choice in that, I'm afraid. What am I going to do now? I have to get my knee fixed, but the doctor says I have to wait till 2011.
I see it all the time, Lynn.
I wonder if those people that talk about the Canadian healthcare system have ever been on a Canadian waiting list.
What can I say, hon? That's what you get with a government monopoly. The price mechanisms we rely on in a competitive market don't exist with Medicare. The government is an inefficient allocator of scarce resources. Everything gets hoarded and rationed. Time, energy, and money get wasted on a massive scale.
What about me?
It's not about you, it's about us. With Medicare, we hit an equality ceiling. There's a minimum guarantee, but nothing beyond that. Everybody must have the exact same equal care, no matter how long it takes or how lousy it is.
Is there no solution?
Maybe you could become a citizen of the UK, or Switzerland, or Germany, or France, or Luxembourg, or Finland, or Sweden. All countries that have better healthcare outcomes than us. All of them give their patients choice.
So I was supposed to lose to a foreign power just to get my knee fixed?
Well, the funny thing is that dogs get faster treatment than humans. The veterinary medicine is not regulated by the government. You simply pay a fee and your dog gets its operation. If more dogs need more operations, the price of operations go up, sending a signal that more vets are needed, and providing an incentive for more people to go to vet school. No horrible wait lines, no lack of options. What you pay for is what you get. I keep a little something here for people who need help. Oh, who's a good boy? You need to see the back? Well, you can see him right away. He's right over there.
Oh, hey, boy. What seems to be a problem? Well, looks like you're going to need an MRI for that. Well, I've got a machine in the other room. If you have some time right now, we can take care of it.
Hi, I'm Matt Bufton. I'm here in Windsor, Ontario, just across the river from Detroit, Michigan. Now here in Canada, we have a universal, publicly funded healthcare system. The government both provides the money and manages the system. In the United States, there's a different system, and there is no universal public healthcare. Critics here in Canada say that if we were to allow private sector healthcare delivery, we'd end up just like they are. But the question is, are these the only two models? Is it possible for a public universal healthcare system to exist side by side with private healthcare delivery? I'm going to go across the street to the University of Windsor and find out what some students think about this issue. So tell me what you think about Canadian healthcare.
Well, I like the fact that we've got socialized medicine.
I think it has its problems, but I think overall it does its purpose.
Overall, I'm pretty happy with it, especially having American friends who have to pay so much money.
I think the actual organization of it is not that great.
I think we can do a better job of providing healthcare to our citizens.
What do you think about the idea of having competition in healthcare with a private sector? With a private sector? I don't think it's a good idea.
I think that competition between the public and private system might be problematic.
I do think it would be a slippery slope, and I think it would be a bit scary. I'd rather have just better basic healthcare for everyone.
I think it needs to be something that can be closely monitored.
The fact is that Canada's ban on the provision of medically necessary services by the private sector is rare in the developed world. Equally as rare is the absence of universal public health care in the US. But are people aware that the socially progressive nations of Europe allow a private sector healthcare system to compete with their public universal system? Would you be surprised to learn that countries like Sweden and France and actually most of Europe has a private sector as well as a public sector in healthcare? A little bit, yeah.
I'd be very curious to know how it's working out for them.
I would be surprised to hear that, yeah, because it's not advertised that way.
Many Canadians are genuinely surprised to learn that so many other nations allow a private sector to deliver healthcare in competition with the universal public system. But it's a basic principle of economics that competition forces suppliers to deliver their goods and services more effectively to their customer base. Other nations use this principle to ensure their citizens have access to the best healthcare in the world. Here in Canada, maybe it's time we realize there's more than just two models of healthcare. We like to think we live in the best country in the world. Maybe it's time we had a healthcare system to match.